Dr. Atul, my question would be to you that, it's very interesting that like many other diseases, dengue also kind of have symptoms that people confuse with influenza. So what are some of the symptoms that people should really take note of and reach out to a health specialist, because testing doesn't happen like we discussed, because people tend to assume that, it's just flu, it'll go with symptomatic treatment. We don't need to really reach out to for proper dengue testing. What are your thoughts on this?
So the symptoms which help us to know whether it could be dengue or something else is very difficult to say, but there are two definite symptoms. One is retroorbital pain behind the eye, that's the thing, which is quite severe. It may be associated with headache. And the other is the pain in the back, which is an important symptom which will help us to know whether this is dengue or not. Rest of the symptoms are totally not very common, like you can have pain in the muscles, nausea, high-grade fever, which is seen in almost any kind of viral illness which is there. But these two symptoms are specific to dengue, which should be asked from the history.
Dr. Bagai, normally how long does a typical dengue episode last, and when does it become worrying?
So dengue, you have a very short prodromal phase, about 1 or 2 days. A child or a young adult or an elderly may feel slightly restless, not feeling himself or herself. Then it goes through, apart from the prodrome, it goes through 4 phases. So one is the acute febrile phase. The second is what we call as the critical, means important phase. The third is the plateau phase. And the last is the convalescent, or what we call as the recovery phase. Now, during the febrile phase, what we call as the acute phase, you'll typically have very high-grade fever, which is 101, 102, 103, 104. It is always biphasic. So you may have fever which comes once every 2 days, or you may have multiple spikes in a day. It's typically called as camelback fever. So you will have 2 humps. So if the first spike of fever goes down, do not feel confident or happy, because the fever may come back. So it's not a sign of recovery if the first phase of fever goes away. With or without any rash, but you will have classical headache. What patients describe is aankhon ke piche, sir ke samne, acute pulsating pain. And that's almost classical. And then, of course, back pain and muscle pain. During the critical phase, there are a couple of important points, if I can highlight. I think clinically and for public awareness, it's extremely important. The fever will gradually wane off, but once the fever breaks, platelets play Bharatnatyam. Please be careful with the platelets when the fever goes away. The ultimate going away of fever is not a sign of recovery. That's when your platelets start playing havoc. Coming to platelets, don't concentrate on platelets. Platelets are eaten away because of hemoconcentration. That means watch your hemoglobin going up. So your blood count and peripheral smear and test is equally important. Apart from that, of course, you'll have little derangement of your kidney function and liver function and so on. Classical abdominal pain in smaller children. Gallbladder gets contracted. And then comes a plateau phase and then the recovery. So your entire recovery period is another 4 to 5 days. So if a patient comes to me with dengue positive in the first initial phase with a NS1 antigen positive, timing of that test is very important. Do not rely on diagnosis of dengue as a first episode with your antibody IgG, IgM. Your full phase will be about 15 to 18 days. After the child is in the recovery phase or an adult is in the recovery phase, you have a lot of muscle pain and malaise. Fluids will keep the patient home. Lack of fluids, you land up in the hospital.
I'll connect to what you said, and my next question, Dr. Madan, would be that, how do we handle the burden? I mean, there is a certain phase when we see a lot of dengue cases, and, how do you really manage, the hospitals from getting overwhelmed with patients admitting, and, everyone wants to be tested, everyone wants to be admitted. What is the balance how do we create that balance?
One of the important things which sir has mentioned, that means fluids. Yeah. See that you are not dehydrated. The moment you are dehydrated, if you are having symptoms, you will end up in a hospital. That means essentially you have to focus on home management. That means the symptoms can be managed, 70-80% of the cases can be managed at home if the hydration and other things is maintained. The moment these warning signs are there, suppose the acute pain in abdomen, the vomiting, and as well as the, some bleeding spots are available, that immediately the person has to be shifted to the hospital. But to avoid that situation, it is better to keep yourself hydrated. Besides that, you should talk about the rural areas, because one needs to understand how our system works. Private sector is there, public sector is there. I will be more focusing on the public sector. Public sector, we have around 2,18,000 hospitals. And in the peripheral most level, we are having the million ASHA workers who are the volunteers. They have been capacitated for triaging this early symptom, because dengue is not limited now to only urban areas. Rural areas are also not untouched with dengue. It can happen across the country. So we have to, it was an urban phenomenon earlier, now it's a rural phenomenon. That means you have to take care of all the people. Building capacity so that they can identify the early warning signs and see that how the patient can be rehydrated. Oral rehydration solutions are there, how to prepare that, what are the locally available fluids which can be given to the patient. That's one thing. Second thing, beside that, we do have a network of e-Sanjeevani program, that teleconsultations which are there. In case of any danger and warning signs, I think immediately the spoke can be connected to a hub and the treatment can be instituted like that. That kind of measures are there so that the overloading on the hospitals can be avoided.
What is your take on these home remedies that keep going viral on social media for dengue management?
So you have asked very interesting question, because we all talk about science. We have to produce evidence for these home remedies and other things. Right now, we don't have evidence to say that this is effective, that is effective. Till the time science comes forward and generates some evidence surrounding home remedies, we have to focus on, see that how the hydration is maintained. If in the home remedies also, if they are focusing on maintaining the hydration of the patient, that is adding to the line of symptom management which we are already propagating.
So, Dr. Atul, something that both the doctors mentioned, about hydration, how that is very important. What does it exactly do, just for the audience?
Hydration keeps your, the hemoglobin concentration enough so that, there is enough, there's all, in fact, the phases which you talk about, in the later phase, there is also leaking of, the blood products from the third space. So with the hydration, you can maintain the level of nutrition which is going on and the electrolytes to the entire body. That's important. And coming back to what you said was the home remedy. So if you take rounds in the morning for the dengue ward, everyone will have that kiwi in their bedside, and they'll have those things which are going. But as we say, that there is no trial on that, but people are taking this, and I think we need to educate those things also. They are basically things which need to go off from our social media.
And also something, Dr. Bagai, I'll come back to you. We've heard, for the post-COVID, this long COVID was the buzzword for a very long time. But off stage, we were discussing how dengue, there should be a term coined, long dengue. Would you like to throw light on that?
This is something which I have researched very extensively, so I'll share some information. It's of huge importance to everyone. But before I touch that, just to add on to both my esteemed panelists, the carry-home message is, yoga does not work for dengue. That's loud and clear. Karela ras, lauki ras, papita leaves do not work in dengue. They may cause more harm than good. Do not experiment with yourself or your relatives at home. Only paracetamol. Do not take aspirin. Do not take Nimucilide. Do not take ibuprofen. It's a guaranteed sure shot one-way ticket to the hospital. It will destroy your platelets, cause gastritis, vomiting, and dehydrate you further. We've seen fatal bleeds with these medicines because your platelets are already vulnerable. So this is the take-home message, and do not take antibiotics. Dengue has no role with antibiotics and vice versa. Coming to your point of something which dengue does. So dengue has 4 serotypes, dengue 1, 2, 3, 4, and at different times of the year in different parts of the world, different serotypes have predominance. Once you have been exposed to dengue, theoretically you can get 3 further attacks. So with dengue 1 or 2 and any one of the combinations does not give you immunity to the other 3. So therefore, if you have dengue infection, your body is sensitized to produce antibodies, what we call as IgG, and your body is ready to fight the next insult. But unfortunately, those antibodies wane and your immunity is partial. So whenever you get the second attack, you get something which is called as antibody-dependent enhancement. Remember ADE. ADE kills people with dengue. We'll touch the vaccines because it's based on ADE. But with regards dengue itself, it's not just a 15 to 18 day. So all recent research in the last 24 months, that means last 2 years, and more so in the last 6 months, and I've read very actively for this show, is there is something which we call as a dengue post-sequelae, and it can last to 300 days or more. That means close to 9 to 10 months and beyond. So I've got these statistics, and I'll take your permission to read this out.
Sure, please.
46% of cardiac risk, 43% of thromboembolic phenomena, major cardiac episodes, 31% increased risk, MIs, that means heart attacks, 30%, tachycardias, 46%, neurological and cognitive effects, 66% increased risk, autoimmune diseases coming in because of ADE, increases by 37%, gastritis, hepatitis, 36%, 230 times increased risk of damaging your kidneys with severe dengue, 22% overall risk of increased hospitalization, and a 208% chance of excess mortality. Now, please understand what clinical medicine is. A patient has dengue, let's say a year back or a year and a half back. There is practically no history because it may be a subclinical. And a patient has a MI. Everyone has spoken in the last 5 years, 4 years or so of long COVID. There has to be a terminology and more work done on long dengue syndrome. This damages more than 10 different body organs with significant impact. It leaves behind traces in which very often it leaves no footprints. So we have to be careful. You have to prevent dengue. Make sure that the mosquito is not close to you.
That's very, very interesting, and I'm sure very useful as well. Dr. Madan, just extending that to you, Dr. Bagai mentioned that there are 4 serotypes and cases of reinfection as well. So how does this pose a challenge for the, public health planning per se?
For public health planning, we are focusing on 2 things. Because irrespective of the serotypes, we have to see that with the patient who is having dengue episode, how he is managed. Second thing, occurrence of the dengue, so that we have to break the transmission chain. So whole effort is made on the surveillance aspect. It's a clinical surveillance for fever surveillance network is there across the country. That means any fever coming to the system institutions. So we have to see that how that fever is labeled and categorized as for this. One of the problem of missing the reporting of dengue is the misclassification of these cases. So fever surveillance network is there across the country, and that reporting is there. The second aspect for public health planning is here entomological surveillance. The entomology which you used to see since 50s to early 2000s, now the older generation of entomologists is now gone. We are having a vacuum of entomologists in the country, across the country. Because entomological studies are very important when we are doing a public planning. Because integrated vector control program is there. That means all the vectors are there. So you have to see that if you are able to control the vectors, then you are able to address the issue and the prevention can happen. For controlling that vector, you do need to have an entomological surveillance and entomological surveillance in place. That means why it becomes important, because In Delhi, it has become perennial. Even the colder months, the dengue mosquito is able to adapt and it can survive. The extensive incubation period of the mosquito, it has reduced. That means after laying of the egg till becoming of the adult, used to be 5 to 7 days, now it has reduced to 3 to 5 days. That means it is also adapting for transmission and other things. That means we are having dual challenges, how to control the vectors and managing the patient. Managing the patient, that aspect is well taken care. But managing the vector, where the vector is there, that's why 7 days are there. You say every week you have to clean your houses so that the larva doesn't become pupa and the adult. That is to be change is to be broken. Har hafta, ek din, aap saaf kariye. That kind of thing, that's based on evidence which is there for the entomological surveillance. Second is about the mosquito control measures and other things. The dynamics have changed. Wherever the Anopheles population has reduced, the Aedes mosquito has taken this. And that we are not having any evidence or any insights on why this is happening. If you are able to answer that why only will come when we can invest into the entomological studies. Not that entomology means only machhar pakad liya kaam kare. No. They have to do some studies, how the strain is happening, whether this is reacting to the insecticidal things or not. Or any biological methods are there which can be controlling these mosquitoes. We have to address the vector issues. That's a challenge which we are facing.
Yeah.
Managing another thing is not a difficult thing. Serological typing, I think once a person is having, he can have 3 more episodes, as Sir has mentioned. But the bigger challenge is the entomological surveillance, and for planning purpose, we are focusing on that.
And for lack of time and something that we cannot skip discussing are the vaccines. WHO is recommending it. India is in the middle of developing one. Dr. Atul, Dr. Bagai and Dr. Madan, I would love to hear your thoughts. Little we are running out of time, but however brief we can keep it.
So briefly, there are 2 vaccines which are being under trial in India. So one of them is the ICMR, which is with Panisha Biotech, and the other one is Serum Institute vaccine, which is a tetra. And the phase 3 trials are going on. It's indicated between 6 and 16 years, and soon the results will be available to tell us whether they are helpful or not. So that's the
Okay.
Okay. To cut a very long story, quick and short and little funny, we have 2 vaccines which have been approved by WHO. One is known as Dengue Vac, and the second one is known as Dengue. The vaccines are as absurd as the names sound. So the first vaccine, Dengue Vac, does not work for the first episode. So you have to have had a previous episode so it can prevent reinfection. So the initial results were so bad that the vaccine efficacy was, in a multiple centric trial, was termed as minus 18%. That means it did no good, it did more harm. Then subsequent trials have shown that it has a very poor waning over a period of 4 to 5 years, and the efficacy goes down. The second one is Dengue. The Dengue is to be used for all purposes across the age groups, but there again, it only works very well for Dengue 1 and Dengue 2, not for 3 and 4. ICMR has started a 3rd phase trial with Panisha Biotech, in which 10,000 volunteers have been enrolled in phase 3 trial. Now, just 2 minutes with I hope your audience are not getting bored. Okay.
I'm sure not.
The vaccine per se for dengue is a slippery little guy, because all recent studies have shown that the body reacts like dengue exposure. 1, if you've had influenza. 2, if you've had SARS-CoV-2, which is COVID, or in southern India, you've had Zika. I'll rephrase this in layman term. If you have been exposed to any of the miscellaneous viruses, it's like taking a hit in your body immunologically wise, as if you've been exposed to dengue. Now, how the body reacts, whether it's dengue type 1 immune response, 2, 3 or 4, is completely unpredictable. So the vaccines, according to me, are a far cry away. Just to, in one line, to mention what this dengue virus is, it contains 275 shared protein interactions with influenza and SARS-CoV-2. it's almost impossible to say which body is going to open up what kind of channels. These are called as activated channels in the proteins of how the body is going to respond. The worst thing which you can do with a dengue vaccine is to give a dengue vaccine and cause with the vaccine a severe reaction. So worldwide studies with the WHO recommended vaccines have shown a 58% increased risk of severe infection. So I would rather keep mosquitoes all out, no pun intended, but keep all out, all in, right, just to keep your home safe. Prevent mosquito bites. Don't bank on a vaccine too soon, too fast.
Thank you.
I agree with sir. One of the important things, vaccines we see as an adjuvant. It's not as the mainstay for this. Mainstay is your surveillance, the clinical management. So we look forward to seeing that how we can improve our surveillance, especially the entomological surveillance, and improve our clinical detection, and the misclassification of the cases is avoided.
Thank you so much, Dr. Madan, for summing up the whole session, and thank you so much for joining us.
Thank you.
What a fascinating back and forth, ladies and gentlemen. And Kalpana, I ask that you please remain on stage to help felicitate our highly distinguished doctor panel with a token of our appreciation. Thank you for being here at the India Health Summit and Awards 2025. Very insightful back and forth on battling and combating dengue really through prevention, awareness, and potentially a vaccine. All right, and Pooja Sethi is also on stage to help felicitate our panelists. Dr. Kakar, Dr. Bagai, and Dr. Gopal. Thank you so much. Thank you, Pooja, and thank you to our panelists. A huge round of applause for them. Thank you so much once again. And now for Dr. Bagai. Thank you for sharing such a rich range of insights. And I wanted to just essentially take a moment more to thank our sponsors for their support in this effort. We are supported by an ecosystem of partners here today. And to acknowledge them once again, the Times Network India Health Summit and Awards 2025 could not have been possible without our partners, who include our Powered by partner Intas. We're co-powered by Novartis and All Out. Our knowledge partner is Dr. MGR, Educational and Research Institute. Our supporting partner is Fit India, of course. Our strategic alliance partner is Onyx Telecommunications, our wealth partner, Nuvama Wealth, and our outdoor partner for the India Health Summit and Awards 2025.